Health Chief Medical Officer Dr. Rose Johnson and Women's Health Nurse and Lactation Consultant Nurse Nikki Sorrow.
Good morning.
Welcome.
Good morning.
Good morning.
Welcome back.
Thanks for having us.
We wanted to have you this month because we've got a couple things going on. One is Breast Cancer Awareness Month. And I guess first, why do we set aside a month? Why do we have a month to talk about breast cancer?
So it's really important, to have this month and to talk about why we do screen for breast cancer and the awareness of it, and then to encourage people to get their yearly mammograms.
So what age and how often should women get a mammogram?
So it's recommended from ACOG and the American Cancer Society to start at age 40, and then you'll be getting a mammogram every year to 2 years.
Okay, what if you have family history?
So if you're at an increased risk or have family history, then they recommend starting at age 30.
Oh, wow.
You guys really have a focus on women's health, and breast cancer is one that typically is specific to women, but there are other cancers that you are concerned about in providing health care to women.
So to screen for cervical cancer, we do pap smears, and then those we do every 3 to 5 years. So we like to do those both in women's health, and then we want you to come in every year to see your women's health provider. It doesn't matter if you're due for them, we still want you to come in, and then we'll be doing those as well.
Cancer screenings, and they've improved. I think the way they're done, some like mammograms or other screening have been uncomfortable for people. Has it become better and easier for the screening?
Yeah, I would say so. I hear a lot of good things about women getting the mammograms. They do take less than 15 minutes, and they're not very painful. We actually have a van outside on Fridays for mobile mammograms, and I know a lot of women really like that. It's really easy and convenient.
How long does it take?
Less than 15 minutes.
Really?
I would say probably less than 5,
Yeah.
honestly.
Yeah, it's really
Such a strong focus on women's health at the center. You currently have 6 OBGYNs. Just talk about the providers and the amount of care that you are offering. Served over 30,000 patients last year.
Correct, yeah. We provide complete women's health care at the center, and we have physicians, but we also have a nurse practitioner, and she worked with us before, then went to her nurse practitioner and came back and joined us, Tracina. We have a new OBGYN, Dr. Wade, who joined us in September, doing really good. She's born and raised in Michigan. She did her education at Wayne State. Her passion is to get women engaged in their care and to provide education. So really wants to work with our community. So very excited to have her at our center, and she's been seeing patients, and we've heard wonderful feedback. Our patients just simply love her. So that's been great. Also want to touch base on our new, we're going back to having nurse midwives. We used to have nurse midwives at the center before, and we know that a lot of our women want the nurse midwife care. So we are hiring nurse midwives. Nurse midwives provide the similar care that our OBGYNs do. They don't do GYN surgery, but they will provide both GYN and OB care. They'll take care of pregnant women before, during, and after. They'll deliver patients. They very much focus on natural ways to deliver the baby, as well as involving the patients a lot in their care. So we're very excited about this too.
Yeah, and things have improved really in our community for access. I remember when Andy was born, I think there were like 8 or 10 total OBGYNs in Jackson, and it was.
I was born in a car, right?
No, you're thinking of
My brother.
no. You were born in the hospital.
Was it?
In the old one.
Oh, the old one.
Yeah,
What was that called? The Anderson Building?
it was called
Foot Hospital.
Foot East.
Yeah, Foot East.
East.
Right.
Yeah. More about women's health and some of the other things happening at the Center for Family Health, including a construction project, when we continue more after this.
for Family Health is proud to announce that all 4 of our school health center locations have reopened and are accepting new patients. We recognize the importance of making sure kids have access to medical and mental health care. When their basic needs are met, kids are better prepared to focus on learning and be present in school. Families thrive when everyone has access to quality health care, so patients of all ages are welcome. Parkside, Northeast, Jackson High, and Northwest Health Centers provide primary medical care and mental health services in convenient locations throughout the community. Call us today to make your appointment or for more information. Center for Family Health, opening the door to health care for all.
Hi, we're Phil and Barb Tripp from Tripp's Collision Centers in Jackson, Lansing, and East Lansing.
I'm Tony Hollow, Executive Director of Big Brothers Big Sisters, Jackson County.
And I'm Megan Forrest, Executive Director in Lansing. With your help, we can impact more families in our communities.
Mentoring relationships and empowering our children and our community.
Please consider becoming a big brother or a big sister.
Do you want to make a lasting, positive impact in Jackson County? A fund at the Jackson Community Foundation creates a legacy in your name or in memory of a loved one to support the causes most important to you. Go to www.jacksoncf.org today and start your legacy.
Back here with Dr. Rose Johnson and Nikki Jordan from the Center for Family Health, talking about Women's Health, Breast Cancer Awareness Month, all of the offerings that you guys provide. Are you accepting new patients?
Yes, always.
Always.
And we know there's a need in Jackson community for all kinds of services, but definitely for women's health. So we definitely want women to call and get appointments. Yeah.
Now, the midwife, that's something that you mentioned before the break. I think people have a misconception, at least maybe I do, of what a midwife.
I'm picturing a baby being born in the bathtub at home.
Yeah.
Is that what you're picturing?
That's what I'm picturing.
Yes.
Yeah.
Yeah, I mean, so nurse midwives want to work with the women to get their wishes, to have the baby delivered the way they wish. Not saying, so if there's any complications, of course they're going to follow what's necessary for that. If the physicians have to be involved, they will. So what our nurse midwives that we see joining us, they will be seeing patients in our office, both OB as well as GYN concerns. They will do call, they'll see the patients in the hospital and deliver them. So that's what we are looking at as far as nurse midwives.
And Nikki mentioned your lactation consultant before the show. I'm wondering, are we seeing, have things improved in terms of, we had the formula shortage last year. Are things better?
Yeah, I would say things are a lot better. And then we also have a milk bank here in Jackson. There's only 29 in the whole country, and Michigan has 2. So there's one in Kalamazoo and then one now here in Jackson. So I went over there a few weeks ago, and it's really awesome. So they're starting to open that up to the public. And
What is the milk bank?
so people can donate their breast milk if they
Okay.
have a surplus of it, and then also women can get the donated breast milk, and then they're also giving it to the babies in the NICU at Henry Ford as well.
Yeah, I was over there. It's amazing. It's like there's a room that looks like a dairy.
Yeah.
All the stainless steel piping and tubes and tanks.
Yeah.
Yeah, it's amazing.
But it's been really good. I help a lot of women at the center too, and then a lot of women I don't need to help because they're just total pros.
Yeah.
So it's really nice. It's nice to see.
It's not easy for everybody, correct?
No, it's not. It's unnaturally natural, I always say.
Yeah.
So
We've got construction downtown. You can't get here from there. But soon, I think in a week, you'll be able to travel up and down Jackson Street.
That'll be nice.
But you've also got something going on. You've got
Yes.
construction crews.
Yes, very, very exciting. So we've got work going on in our downtown 505 building, where what we're doing is expanding our walk-in. If anyone has been there, they know it's pretty congested right now. So we're very excited, and we'll move our walk-in out of where it is now. We'll be opening in Blackstone temporarily for our walk-in patients, and then a year later we'll be back, and it'll be amazing when we're back at 505. But we're also going to have a drive-through pharmacy, and that's the other construction that's going on downtown, is for a drive-through pharmacy.
Yeah. The old, remember the Birmingham?
Cosmetic Plastic
surgery?
Reconstruction building. Yeah, I do.
Yeah, that didn't work.
Well, it just
Old
didn't last.
Birmingham.
Yeah, I think it was the wrong name.
Yeah.
Yeah. But either way, it's now the center. So
I've been working on it. You added more parking up there.
Correct. Yes, we've made it so that patients will definitely have space to park. We've done some renovation in the building in Blackstone too, so that'll be definitely patient friendly.
yeah, Jackson is very lucky to have the Center for Family Health and of course all the providers and resources. Very
Appreciate
lucky.
that. Yeah, thank you.
Yeah, and the drive-through pharmacy.
Yes.
Yes, the drive. We think that's going to be a great help for our
Yeah.
patients too.
If someone wants to make an appointment, anyone can.
Anyone
at any
can.
of the, and they can pick all the locations you have, right?
That is correct. Yep, that is correct. They can come to our main. They can come to our schools. We also have a clinic at Lifeways, where we have an APP, an advanced practitioner, working there to see patients.
Great. Well, we appreciate all you guys do for the community. It's truly a gem. And if you do want to make an appointment, all you have to do is call 748-5500. Nice to see you both. Thank
Yeah.
you.
Thank
you
you.
guys.
Nurse Nikki Sara and Dr. Rose Johnson from the Center for Family Health. Believe the Hype's coming up next.